Please mention in the chat box. So in today's session, we'll just do a briefing, infection control, infection prevention and control in a nutshell. Okay, we'll just go through all the relevant topics under this particular subject. Okay, just a brief, so you have an idea what entails in this particular subject. Okay, it's relevant to everyone who is a practitioner or who are a part of healthcare activities. So infection prevention and control, according to WHO, World Health Organization, infection prevention and control is a scientific approach and a practical solution designed to prevent any harm caused by infections to patients, health workers, and even the visitors in the healthcare system. They all needed to be protected from infection, getting infection, cross transmission. Okay. So IPC is considered as a part of epidemiology. It is also an important function in comprehending the infectious diseases, social sciences, and global health in general. Okay, so this is just a brief understanding of what infection control is. What is the main aim of infection control? So that you can prevent any infection, spread of infection to patients, health workers, and visitors within each other. Healthcare associated infections, HCAI, in short, we call them, occur when receiving healthcare. It develops in a hospital setting or in any healthcare facility. It first appears within the first 48 hours of admission or more after hospital admission, and in some cases within 30 days after receiving any form of healthcare treatment. You may also get a hospital acquired or healthcare acquired infection. It was earlier called nosocomial infection, which referred to those infections linked with admission to acute care hospital. But in present times, it is a vast topic. Okay, it goes beyond acute care hospitals. Okay, so it includes infection that is developed even in various healthcare settings where patients obtain healthcare, not just limited to hospital. Okay, even in long-term care, palliative care, hospice hospitals, clinics, small clinics, family medicine clinics, home care, ambulatory care, anywhere where health care is provided. Okay, any treatment, prevention, or diagnostic services provided in any setting, healthcare or associated infection can take place. So now it is no longer called as nosocomial infection; it is called as healthcare associated infections. So patient safety. Institute of Medicine defines patient safety as the prevention of harm to patients. The most fundamental principle of any healthcare service is first do no harm. But every aspect of healthcare activities or processes contains some degree of inherent safety issues, which humanly it is not possible to completely overcome. Okay, some inherent safety issues will be there in any care activity that you provide to your patients. So patient safety is considered as a cornerstone of high quality healthcare. So any hospital whose major focus and major objective is towards patient safety, they will ace in all the infection control and prevention activities. Am I audible? Is my voice clear to all? Common sources of patient harm. These are the main areas where a lot of patient harms have been recorded. The first is medication errors. There are different forms and types of medication errors, which in detail we will discuss in our infection control and prevention classes, ICM classes, every Saturday. So there is an entire chapter on this. Surgical errors, healthcare associated infection, that is another chapter on this. Sepsis. Okay, sepsis means getting infected with two or more bacteria or microbiome, that is called sepsis. Then diagnostic errors, giving wrong diagnosis, faulty diagnosis, patient falls, venous thromboembolism, okay, like while administering any medication, if you are not giving proper, not following the proper way of administering injections, it may lead to air bubbles going into the veins, that is venous thromboembolism. Then pressure ulcers, if the patient's bed sores, we call it as, okay, another name for pressure ulcers is bed sores. Long-term care patients, if they are not taken care of well, if their movement, okay, body massage, personal hygiene is not maintained well, they may get pressure ulcers. Unsafe transmission practices, patient misidentification, unsafe injection practices. So these are the common sources of patient harm. So elements of infection control, infection prevention and control. So these aspects include, first and foremost is hand hygiene, okay, healthcare associated infections, injection safety, antimicrobial resistance, outbreak management, surveillance. Each one of this we will just go through briefly, okay, in detail. Each of these topics in detail, we have separate chapters in our course of infection prevention and control, ICM course, okay. There is a separate chapter for each one of these topics. First is hand hygiene. 5 moments of hand hygiene is the most important thing you should learn. Okay, hand hygiene alone can prevent a lot of transmissionable infections and diseases. Okay, even multi-drug resistant uh, infections like MRSA, VRE. Okay, main causative factor of the spread of these infections is not doing proper hand hygiene practices. So the first moment, there are 5 moments of hand hygiene. The first moment is before you touch the patient, okay, before touching the patient, to them against any microorganisms from hands of the healthcare worker. That is the reason why we do this first moment. Before touching the patient, wash your hand. Before a procedure, to protect the patient against microorganisms from entering the patient's body, which also includes microorganisms from the patient's own body. One side which is infected, the other side which is not infected. Okay, to make sure that transmission of infection from the same body and also from the other patient's body is not done. Okay, it's not possible for that. Before doing any procedure, hand washing has to be done. Moment 3, after procedure or body fluid exposure, risk to protect the healthcare workers and environment from becoming contaminated with patient's microorganisms. That is the third moment of hand washing. After you have completed the procedure, wash your hands so that when you move forward with your healthcare practices to another patient, you do not contaminate the other new patient with the previous patient's microorganisms. Moment 4, after touching the patient, to protect the healthcare worker. After touching any patient, wash your hand before you touch your own body. So to protect yourself, to protect other healthcare workers. After touching the patients, wash your hands. And after touching the patient's surroundings, to protect the healthcare worker and the healthcare environment, that is the reason, from becoming contaminated with patient's microorganisms. Okay, so these are the 5 moments of hand hygiene. Or in all these 3 time periods, hand hygiene has to be followed. Before touching the patient, before doing any procedure, after the procedure, after touching the patient, and after touching the patient's surroundings. Factors determining healthcare associated infections. First is host factors, like people who are in old age, senior citizens, they are at higher risk of getting healthcare associated infection. Debilitation, that is people who are critically ill, multi-organ failure. Okay, their condition is getting critical day by day. Immune suppression, patients who are on immunosuppressive drugs, okay, for various the health reasons. If you are on in immunosuppressive drugs, you will have higher risk of healthcare associated infections. Hospital settings like space, uh, if there is no adequate space between two patients, it's too congested, keeping the patients too congested and too close to each other, high risk of healthcare associated infections. Ventilation, which is not proper, there is no proper air changes, at least 5 to 6 air changes per hour should take place in any general ward. Okay, if these air changes are not happening, it's not a good ventilation system you have, so that leads to healthcare associated infections. Then cleanliness, not having good housekeeping services, not keeping the surroundings clean and healthy, okay, and ambient, that would lead to healthcare associated infections. Then procedures in diagnosis, it can happen therapy while giving treatment, care, patient care, specific patient care, rehabilitation. Okay, during all these procedures, anywhere at the point of care, HCAI can take place. Then microorganisms, nowadays, superbugs, multi-drug resistant infections are the major healthcare problem which we see. Then virulence factor is increasing day by day for various viruses. Okay, it is getting difficult to tackle viruses with old set of drugs. So their virulence, they are getting stronger. The viruses are getting stronger day by day. Okay. So these are the microorganism factors. So these all factors determine the rate of healthcare associated infections in today's world. Injection safety. Common unsafe injection practices are as follows. Needle stick, which leads to needle stick injuries. That is also another main topic of infection control and prevention. While administering medication, using the same syringe for more than one patient, a big no. Okay, do not practice these things. One syringe at one time for one patient. Accessing a medication vial or bag with a used syringe that you have used on a patient, and using the same syringe, which when you use a syringe with needle, okay, the needle is made only for one time use. Okay, if you look at it under the microscope, the needle disintegrates after single use. And using that disintegrated needle, you use it frequently and to poke into another vial bag, okay, the quality of the needle is gone. That leads to other needle stick injuries as well. Then by accessing the remaining contents from that vial or bag for other patients, okay, you are spreading infections through this. Single dose or single use packaged medications used for more than one patient. Whatever is single dosed medication or single packaged medication, do not use it for more than one patient. Keep that for a single patient. Okay, a single dose medication, single vial medication should be finished within the single dose. Okay, it should not be kept for another day or another routine. Not following aseptic techniques when preparing and administering injections, hand hygiene, personal protective equipment. Okay, the keeping the patient environment clean and hygienic. So these are all the aseptic techniques you have to follow before you give injections or medications to the patient. This is about injection safety. Next main topic is antimicrobial resistance. So according to World Health Organization, antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites change over time and they no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illnesses, and death. Okay, so now they are not responding to the medications they used to respond few years back. Okay, that is antimicrobial resistance. It threatens the effective prevention and treatment of a range of infections caused by bacteria, parasites, viruses, and fungi. Okay, we are not just looking at the problem of antibiotics, we are looking at the problem of antimicrobials. Okay, antimicrobials means all the antibiotics, antiviral, antifungi, antiparasitics. Okay, everything comes under the major umbrella term of antimicrobial. Okay, so we are looking at antimicrobial resistance, superbug resistance in the future. Okay. So what are the key measures can we adopt to prevent the control of infection in a healthcare facility? So first, establish an infection prevention and control committee, hospital HICC committee. Good hand hygiene practices should be inculcated into your staff daily routine. Effective diagnosis and treatment of infection should be done. Rational antimicrobial use has to be done. Okay, surveillance of antibiotic resistance and antibiotic use, improving the antimicrobial quality and supply chain, good microbiology practices like using an antibiogram. Okay, antibiogram has the list of uh, this bacteria that cause infection and which exact class of antibiotics has to be used for this particular bacterial infection. So do not jump the classes. Only use uh, narrow spectrum antibiotics for narrow spectrum bacteria. For broad spectrum bacteria, use broad spectrum antibiotics. Okay, you do not have to jump the classes. That is what antibiograms teach you. So this is also a part of a good microbiology practices. Okay. These are the major recommended measures. In detail, we will study in the chapters of infection control and prevention classes. Next, we have outbreak management. In healthcare settings, outbreaks spread are due to hand or environmental contamination. So, any invasive devices and procedures that could also lead to an outbreak. So, common modes of transmission of outbreak are common source outbreak, in which there is for example, food poisoning, okay, water poisoning. A single source is causing the outbreak to various many subjects. Human reservoir, a single person is causing has led to an outbreak. Okay, the a person who is a carrier or who has an infection goes to a concert or goes to public gathering, okay, and they spread it to n number of people. That is a human reservoir. Okay, usually carriers. Cross infection, person to person, one to one person. In this outbreak, it is subject to subject. Okay, it is not common source, it's the opposite of common source. One person gets infected, they transmit it to another person, that person will transmit it to the third person, and so on. It's a chain reaction. Okay, airborne infections, all your airborne infections lead to outbreaks. Seasons of flu, seasonal flu, and all type of outbreak. Then other environmental, like a fomite or introduction of a new type of medical device, that could lead to outbreak. And uncertain reasons, we do not know exactly from where this superbug came or from where this infection is spreading. We do not know about it. Next is surveillance. Outbreak has various steps, about 10 steps. Okay, outbreak management that we will discuss in infection control classes. Surveillance of antibiotic resistance, healthcare associated infections, outbreak. Okay, these are the most important functions of hospital infection control program. Surveillance in public health is defined as the ongoing systematic collection, analysis, and interpretation and dissemination of data. What data? How many patients are infected? How many patients are getting COTI infection, CLAPSI infection, SSI infection? When did they get admitted? Within what time frame the infection started? Okay, when you dig deeper into these reasons, why, when, where, how, okay, when you start finding answers to these questions, you are doing a surveillance. Okay, but take the topic of COTI. How many patients with catheter had UTI infections? Why did they had UTI infections? When was the catheter placed? What went wrong that these patients got COTI infection? When you start this research for every single case, you are doing surveillance. So that is the collection of data, analysis of data, interpretation of data. When you find answers, when you interpret your answers, you find solutions as well. Okay, so that's the reason why surveillance is very important. Okay, you cannot let go any case of COTI, CLAPSIs, SSI, outbreak, antibiotic resistance. You cannot let go any single case. Every single case has to be thoroughly researched of what went wrong, what led to this situation. Okay, this data collection is what we call as surveillance. Okay, and public health authorities will be informed about whatever data you have collected. Your interpretation analysis will be sent and will be reported to the public health authorities. They will take the action to reduce the morbidity, mortality, and to improve the general health of the population. So that's about surveillance.